Thank you so much for joining us, everybody. We're coming to you in a bit of an emergency circumstance because of the information that has become public over the course of the past 24 hours or so about the impact that the coronavirus COVID-19 is having on communities of color, and particularly in immigrant communities and more income communities across the country. But here in Massachusetts, there is no community that has been as impacted or affected as Chelsea. And the numbers speak for themselves, but they are literally off the charts compared to any other community around our Commonwealth. And so we wanted to talk about that tonight. And we have this extraordinary panel of public servants from Chelsea that are here to discuss what they're seeing, what they're doing, and the help that they need in order to care for the people that they serve. And so thrilled to have Roy Avenida, who's the city council, if I came close to pronouncing your name right, forgive me, Roy. The city council president who's been on the city council for over 20 years. Judith Garcia, city councilor from District 5, who is the youngest elected official in Chelsea, and also vice president of council. Dylan Power, who is the executive director of Greenwoods Chelsea, a organization that has been on the forefront of an environmental justice movement in Chelsea for 20 years. And so as dedicated public activists and advocates and public servants, as you will find, who are at the moment doing they can to try to protect their community. And I think there's an awful lot that we can learn from this and that we need to do to support, to care for people across Chelsea. And so, Roy, Mr. President, we can start with you. Just tell us a little bit about what you're seeing and what you need.
Well, thank you again for introducing us and allowing this forum so that we can speak about our needs and what's going on in the community. You obviously, when you look at communities like Chelsea, not only minority communities, but more importantly, just poorer communities, we are going to hit harder when things like this happen. And if what we're seeing on our level here is because there is a complete stop of our economy. Those depend on living week to week to pay the basic staples of life, which is food and shelter. That's what we're seeing on the need. And I'm right now working in collaboration with Gladys Vega, the executive director of the collaborative, and doing a pop-up food kitchen. Even though, we have resources here, and what I mean by that is someone like Ron Fishman, who's running the ones that we have always had and have doubled in their efforts. We still have individuals who are not, being taken care of, just because the need is so high. And if we were to say, what do we need on from assistance from a federal level, so to speak, we need money, a direct assistance from the federal government to local communities that can help pay for food and for shelter. Judith can talk a little bit more about that, but we are struggling right now in finding to buy the supplies. We, lucky that Chelsea had at least some monies in free cash to give the Health and Human Services Department start to go buy more food and medical supplies. But we're finding that the housing part is the hardest part, because as much as we have the money, finding a shelter is the difficult part. And there's two parts of that. One, to try to get those people who don't need hospitalization but do need to be separated from their loved ones. And in Chelsea's case, we have a housing stock that is primarily multifamily type. So you have a 3-family or a multifamily where you have a number of people just walking the same corridor, so to speak. 2-3 bedrooms is the norm. And so if we're going to have one individual in that family come down with COVID-19, we need to separate them. They have nowhere to go. And powerless to go and negotiate with hotels and primarily lodging houses. And we would say, give us the power that during an emergency, a status of emergency, tell us that we have the power to commandeer a hotel and say, we can take over that, because right now they're empty, they're not doing much business. And I would say just when there's a status of emergency, that we can take over and we can provide not only housing for those people that where our residents were tough to separate. But aside from that, I have to speak about our public safety officials, our firemen and our police officers. Once our calls are increasing right now. They're 10 a day for flu-like symptoms, and it's only going to get worse. And every time they respond, they're being exposed. And if we quarantine them, I don't think it's fair to send them home. They have a house, but I don't think it's fair for them to be sent home and then possibly expose their family. So there's two parts of that housing. But in the nutshell, we need money. And we need the power to take over some of these hotels.
Judith, we were talking, Roy, thank you. And thank you for giving us the summary of kind of where we are and what you need. Judith, we were talking a little bit before. You have some of the updated numbers. So fill us in a little bit as to what this really is about and what the data that you're seeing actually says, to put this in context for people that might not be as aware of it as we need to be.
Absolutely. Again, Joe, thank you so much, first of all, for allowing this dialogue to continue because it's so important, especially for our communities. The numbers are frightening, changing constantly. And just a few minutes ago, I got the confirmation we have 10 deaths in our community, 387 confirmed cases, and the rate by which our community is being impacted, we are currently at 96. So 96 confirmed cases per 10,000 residents. And that is scary. As a leader, I honestly feel powerless. I don't know, what would be the best effective method to help our community. I cannot tell you how many calls we get per day, how many messages we get from our residents, because the need in our community is just escalating. And it comes at no surprise that communities like Chelsea that have a predominantly immigrant population are being impacted way more. So to add a little bit more to what my colleague, Councillor Reynolds, is saying, yeah, we need money, but what we actually need is more intentional leadership that can really be more hyper-focused and intentional on realizing that communities like ours, we're not only being impacted by the pandemic and confirmed cases and that growing number, but we're also seeing negative externalities of that. We're seeing a huge economic shift. We're seeing folks who do not qualify for many benefits that are being extended out there because of their immigration status. So what we need is leaders who are going to push for priority funding, testing and facilities for communities based on the rates of infection. So we're talking about communities like Chelsea, we're talking about communities like Lawrence and Brockton, who are leading the charts in terms of confirmed cases and the spread of it. It's no lie that everyone in the state of Massachusetts is being impacted, but let's take a look and focus on those pockets and segments of our state that are being impacted the most. So that is what we need.
And just to put that 96 figure in context for everybody, the data that I have is actually, it's older than the data that Judith just cited, but from just about 24 hours ago. Rates for Somerville, 12.7, and for Chelsea, 96. Rates for Brookline, 22.5, and for Chelsea, 96. So essentially 5 or 7 to 1 in communities like Somerville and Brookline compared to what we're seeing in Chelsea. And Mary Belen, I know you've been working on these inequity issues here from an environmental justice perspective, but you and your organization have dedicated themselves for an awfully long time to looking at the structural challenges here. Walk us through what your take on this and what needs to be done in the immediate term and then in the longer term too to rectify some of this.
Definitely. Thank you for having me, and thank you for having this conversation. I think, what's clear to us is some folks may be shocked at the numbers, and while we never expected this, this is not a surprise. I mean, the three definitions, the three factors of environmental justice are language, race, and income. Every census tract in Chelsea fits the definition of an environmental justice community. So the entire city of Chelsea falls within the definition of what is a population that needs the additional resources. For decades, we've been trying to pass legislation, decades, in Massachusetts that would allow additional protection to communities like Chelsea, Brockton, Lawrence, East Boston. I mean, we've been ringing the bells, we've been ringing the sirens, you know, and obviously in different contexts, but we know that the 3 high-risk conditions of hypertension, diabetes, and respiratory illnesses are high rates. We have the highest rates of those in Massachusetts. We have the highest rates of respiratory illnesses. I mean, the definition of what does it mean to be a vulnerable community, we are it. This is it. And so for
vulnerable meaning in multiple different contexts, right? I mean, what the conditions that you just highlighted are the conditions that make you more susceptible to a longer lasting, far more vicious infection by COVID, right?
Exactly. And to that, you add, you know, we have that one of the highest concentrations of our workforce are these essential employees.
Right.
Our workforce are the service that are the backbone of our economies. So, and on top of that, inequities. And we know that housing is a social determinant of health. And we know that transportation is a social determinant of health. And we have homes where we know many of our members, entire families living in 1 bedroom. So how do you social distance? How do you socially isolate people? It's impossible.
And I assume, not to interrupt you again, Maria, so forgive me, but I assume that for a number of those families, it's also multi-generational, right? Where you're going to have kids that might be more resilient to this, thank God, kids, parents and grandparents, and those grandparents that aren't. And so you end up in the circumstance where you can't get that distance, and even if one is sick, you can't isolate, right? To Roy's point, and how these pieces come together, and that need for that isolation, because you can't, putting somebody just saying stay at home just means you infect more people in that house. It doesn't mean that you should actually pluck somebody out of isolation and there's an extra bedroom that people can stay in for 2 weeks.
Right, exactly. Yeah, and I feel like what's really hammering home is that this is what poverty looks like. This is what being a poor community, an immigrant community, a community of color, is that people are going to die in unprecedented numbers. And we should have been ready for this.
Joe, if I may jump in,
Yes, of course.
I want to say this. You know, we have the resources. This country is a wealthy country. Okay. And if you told our community, if you told the community across this country that don't worry about it, don't worry about the rent, we're going to work with the banks and your landlords, and you're going to not have to worry about your rent in April 1. You're not going to have to worry about your rent in May. If you told them, don't worry about food, we're going to have food for you. Then the risk that our community took by going to work, because that's what their thoughts, what that process was. They knew, look, I'm living week to week here. My paycheck, this and it's not enough. So I have to risk my life at this point, because that's all you thought. If you told our community a month ago that we were going to have these resources, we wouldn't have been packing ourselves in a 111 and a 116 bus. We wouldn't have gone into work and faced our jobs and said, okay, I'm working in a job that's face to face. I'm not going to clean the air. I'm not going to clean the airplane that just came from China. I'm not going to go into a service. I'm not going to clean this hotel and so forth, because this is not a poor disease. This came from outside. And yet our community was exposed to this. Okay, if you told them we had those resources and they didn't have to worry about it, then the high rate that we see wouldn't have happened. But by the time this country and everyone got together and said, this is the steps you need to take, it's already too late. And I hate to say it, but it's already too late. And no one can criticize our community right now because, oh, they're walking outside and not wearing a mask. Look, I'm sorry, this was done a month ago. Our faith, the faith of our community, was sealed a month ago. And because we had to take, and we've been making in our community, and other communities like Chelsea have been making these sort of decisions on a regular basis. That's why you have guys who remove asbestos without the proper gear. That's why you have coal miners taking that job and so forth. It's a regular basis. So until this country gets real about the risk our poor people across this country take, you know, in order to just put food on the table, we're not going to get real. So up this right now and say, yes, we're going to go hat in hand and beg the government to say, give us money right now to try to make sure that we can feed and house and separate. And hopefully, if they come down with it, there'll be a respirator there waiting for them. Hopefully.
Maria, did you want to jump in?
Yeah, I was just going to add you know, we do community organizing and we mobilize and we fight against these industries that are contributing to the pollution in our communities. And, you know, we fought a power plant in Chelsea a long time ago, before even my time with this organization. And we want, some people think we're crazy when we organize, but this is what it means. When you add pollution to these communities, and then we are hit with a disease like this, the disease doesn't impact everyone the same. So the substation that we're fighting in East Boston is relevant. The projects that we're fighting are relevant because clean air, clean water. These are the consequences that when you have a system set up to have people that are poor, that are people of color, that are immigrants, living in communities that are polluted with some of the highest rates of diseases and air pollution, this is what happens when we're hit with a pandemic like this.
Judith? I think you're on mute.
Yeah, I mean, I think everything that's being highlighted now sets the stage for a perfect storm, right? And that's what we're seeing, and that's what we're experiencing. You know, for me, it's very emotional, but it's also very inspiring to see that despite all this, our community has come together to create a response team, to create the resources for our community. But above that, you know, I think what hurts the most is the fact that we're alone. We're on this alone. You know, we know that the Commonwealth is doing whatever they can to focus a response throughout the state, but we have not been seeing and getting the help that we would like to receive. So, you know, at this point, we feel like we're working on this together, but we're on it alone. You know, just on Monday, Councilor Avellaneda and myself had to run into a council meeting with some of our colleagues to approve $500,000 in emergency funding to really target some of the issues that are arising in our community because of this. You know, there's a lot of undocumented folks or other COVID positive patients who return home to try to recover from this disease, and they're being turned away and they're homeless. So now it's become a responsibility of our municipality to take over and ensure that these residents focus on just getting better and recovering. And we're providing that housing, that emergency housing through either, you know, closing a contract with Quality Inn in Revere to ensure that our folks have a place to sleep and create that infrastructure, just use that infrastructure that's already in place to ensure that these folks are having a place to sleep, are having bathrooms accessible to them so they can fight this disease. And unfortunately, it's added trauma that our residents have to face. So again, like a lot of that burden is shifting to us, and it's our responsibility to really respond to these issues.
I want to build off of what Roy just real quickly here. Two things. One, the framing of this, I think that you articulated is 100% right. We have a healthcare crisis that created an economic crisis. So the federal response, from the way I've tried to articulate it, is needs to be and needed to be. In order to save our healthcare system, you had to essentially crater the economy. You had to tell people to stay home. The only way that works is if the government then steps in and says, don't worry about your rent, don't worry about your mortgage, don't worry about your food, we'll cover it. And there's a couple ways to do that. Either one, direct cash payment, which the bill that we just passed said if you're making under 75 grand, you get $1,200, and that's great. $1,200 even in Chelsea doesn't get you that far, right? And so I had come out with $4,000 per person. So much more generous, and the goal basically being So for a family of 4 making under $100,000, you get $12,000, right? And the goal there to be provide each family the security that they need to really focus on themselves, stay home, take care of yourselves, get healthy, stay healthy, and not worry about anything else, so that we can in fact get our healthcare system up and running, right? And then we can get in front of this. The second is a forbearance option, right? Which basically just says to everybody across the board, right? That renter, you don't have to pay your rent. To that landlord that owns the building, you don't have to pay your mortgage. To that bank that then has an obligation to their creditors, you don't have to pay that either. Just a complete down the chain freeze, so that you don't have a default anywhere there, but you just hold it until we get back up and running, because this does not work, right? The response, 2.2 trillion, as robust as it is, does not, as of now, does not work. It's not going to meet that need because we were late on it. The second point, and I just wanted to highlight, and I've had this conversation with, I think, all of you at one point, but not this iteration of it. A couple of weeks ago, I did go down to the MBTA garage in Charlestown. And I was talking with some of the drivers, and keeping the 6 feet apart, but hearing some of their stories, and they were livid. They were livid because the city was at that point on a Saturday schedule. But they pointed out to me, literally, that in a community like Chelsea, that 111 bus was packed, because everybody in that community essentially needed to go to work to make rent, or was working in a job that was deemed essential. And if you shut down if you reduce the number of buses, but you still got people that need to get to work, all that means is you get more people on them, and they were packed. I have a driver that's sitting there going, hey, if somebody's coughing in the corner, and I'm now doing circles across the city, am I infected? And 2, did I just go and infect dozens of other people? Right? But I thought it was interesting that they highlighted the 111 bus from Chelsea as the example for the bus route that was packed, even when the rest of the city was a ghost town.
And Joe, and let me just say, add to that. You talk about that $1,200. Remember, a greater majority of the people in this community aren't going to get that $1,200. Yep. So you can go and set, oh, we're going to give money directly, which is why I go back to you and say, hat in hand, please make sure that the monies go to local communities, especially those that have high rates. Put a caveat on that and say, this money, if your community has an X amount of cases, we're going to throw more money, because that community is going to be able to let this city find the housing, let this city pay for food, and we will use it, because we know that the $1,200 check is not going to get to the people that are living in this city. We know that.
Maria, if I can circle back with you, Maria Bellin, the numbers that Judith pointed to earlier, right? 96, the infection rate of 96 per 100,000 in Chelsea. I pointed out those numbers for Brookline, for Somerville, to try to give some context there. But I think what's also stunning is, and Judith can correct me if I'm wrong, but from the numbers that you read before we got on, the next highest number in Massachusetts is about 60, right? So you are 50% higher in Chelsea than any other community in Massachusetts.
Right.
And obviously, as you know, as well as anybody, the cities that Judith also listed, Brockton, Revere, Lawrence, immigrant communities, lower income communities faced with some of the similar challenges as Chelsea, you know?
I think, yeah, and it gets to the point of these communities, like you said, low income, communities of color, immigrants that have the social determinants of health that are below average, but also the concentration of the service employees. You know, we're talking about the 111. We look at the numbers of the reduction of how many folks were riding public transit when we were told to stay home. And you could see that the folks riding the buses, especially the 111, was still crowded. And also the Blue Line from East Boston. You can tell by looking at those numbers what services people work in. And so I feel like, you know, I was doing a quick interview with Telemundo earlier today, and I said the number of 88 per 10,000, and now it's 96. And it's going to keep going up. And I feel like this is horrible for our communities. And the fact that you listed the Brockton, Lawrence, Revere, Everett, we know that our communities are going to be hit worst. And we need resources. We need resources for the medical response, but also for multilingual communication. We need resources for housing. We need a lot of resources to respond to to all of the factors that are going to impact people's lives.
Judith, do you want to jump in?
I mean, exactly. We just need, as I said before, what we need is intentional leadership that focuses on helping the communities that are seeing the highest rates. That's what we need. We need leadership that can really cater their messaging to communities like Chelsea. We're a community that is predominantly an immigrant, but we also have a high number of undocumented residents in this city. We need messaging from officials on protection for immigrants and low-income people, especially because these folks are seeking medical care, and sometimes they don't go to a hospital because they're afraid that their immigration status is going to impact their treatment, or are they going to be sent home? Are they going to be deported to their country if there is no protections towards them? So I think that the response needs to be holistic. I think we need more intentional leadership that really speaks to the needs of communities like Chelsea.
And let me jump in there real quick, and then I want to give everybody a final word to end on here. But we pushed the initial federal responses. We pushed very sure that testing was free, and all of you will remember that initially it was not. There were stories of people that were confronted with bills that were literally in the thousands of dollars just to get tested, and some folks that even had insurance, but there were not junk insurance plans that the Trump administration tried to sell. And so we were able to make it so that if you are able to get a test, that test is going to be free. That's great. The challenge then becomes if you need treatment, right? One of the just vicious parts about this virus is that for those that end up in the hospital and then in the ICU that are intubated on a ventilator, those ventilators, I had a friend's daughter who was on a vent for over 2 weeks, right? 2 weeks in intensive care at a med-flighted or medevac into a Boston area hospital. Her healthcare bill, it has to be several $100,000 by the end of this. It has to be at 2 weeks in an ICU in a Boston hospital on a ventilator. It just has to be. So the just perverse nature of this, where we're going to say to lower income communities, particularly for folks that might not be here with proper documentation, that you might get the test, but you're still not going to get the treatment because the treatment's going to bankrupt you. So you're not going to get it. So you're going to stay home and you're just going to infect more people, right? The fallacy of this logic is so obvious that if you are committed to actually ending the spread of this disease, you got to make sure that everybody gets access to healthcare and health insurance, because if you don't, it's just going to continue to spread. And hopefully we are able to take this lesson and see the ways in which the structural inequities that you all have pointed out, to use this as an opportunity to actually help heal them and to start filling them. Because if not, the pain that this virus is going to extract off of our community and our country is going to be far more severe. So with that, Roy, if you got any closing comments, and we can go from Roy to Judith to Maria Belen.
I think at the end of the day, we have to look at a community like this and say, what are the resources we're going to get from the state and from the feds? And Maria Belem's talked about our needing that we have a lot of environmental injustice here going on. We need greater safeguards in these, and those resources from the state have to come here and from the feds here. So that no one can just set up shop and continue to operate in a way that would not be allowed in another richer community that could defend itself. We are facing a crisis right now, and a health crisis, and the resources we're going to need, again, I keep on saying, repeat, we're going to need funding, because we have our police and our firefighters who are getting sick. We're going to need resources to pay for overtime and to provide, like I stated earlier, the food and the shelter. So yeah, I keep on calling out and saying our communities continue to say that we're underserved and underserviced, underprovided, and we need to have leaders to look at us and help protect us, because too many times our voices are not heard.
Yeah. Thank you. Judith.
I agree. Way too many times our voices are not heard, and I think Maria Belen has really drawn that picture very clearly from just decades of injustices in our community, from environmental to socioeconomic. And unfortunately, this pandemic will leave a huge imprint in our community. And once the health hazard is over, we're going to face and we're going to see the impact in the long haul for our community. So I hope that we can continue to come together. Chelsea has historically proven itself to be a resilient community, and for long, our voices have not been heard. So I hope that we can find leadership at the federal level that can really represent us properly and advocate for our communities, because that's exactly what we need. We need someone who is intentional, as I said before, because the rates are growing and it needs to stop. So I look forward to keep working with my people here in our community, many of our stakeholders and leaders, to ensure that we flatten this this crisis as much as we can, and hopefully we learn the lesson that we need more. We definitely we need more in our community.
Thank you. And Marie Belen.
Thank you, and thank you for having this conversation. I just want to reiterate our bread and butter is community organizing around environmental justice, and we've been raising and ringing the bells and the sirens that this is a crisis of environmental injustice, and that language, income, and race are critical factors for communities, and that we need to take that into consideration when we're allocating resources and when we're protecting communities. And we have to make sure that we protect the communities that are the most vulnerable. And in this case, it's immigrant communities, it's low-income communities, and communities of color, like Chelsea, like Brockton, like Lawrence, like Revere, and so many others in Massachusetts and also across the country. We will see at the end of this pandemic that those who died in the communities that were most impacted are exactly the definition of the environmental justice populations: low income, non-English speakers, and communities of color. So we just need to keep saying the message that we need additional resources, and we need to tell our communities to seek help when they need it, that there is help, and to not be fearful, that there are protections already for undocumented populations.
Thank you all for joining tonight. Thank you for your voices. Thank you for your service. Thank you for your advocacy. Thank you for what you're doing. And the only thing I would add is that, and yes, this is obviously a critical issue for the people of Chelsea, and literally a matter of life and death. But this is also a challenge to the character of this country, and whether we as a nation and as a federal government will, knowing what we know, knowing the statistics that Judith laid out and that Maria Bowen talked about, knowing, Roy, how you framed this discussion at the beginning, knowing that, whether a federal government will choose to ignore it and do nothing, or whether we are actually going to try to answer that call, understanding that the urgency of the moment, as you said, was a month ago. But that doesn't mean that we still can't save lives now, and that we better mobilize with everything we've got. So stay healthy and stay safe to you and your family and your loved ones. Let us know what we can do, and thank you for all that you're doing to protect your community. Grateful for it.
Thank you.
Thank you.
Thank you.